Hello, everybody. This is Joe Freudenberger, CEO for OakBend Medical Center in Richmond, Texas, coming to you today with a Cup of Joe. Brief conversation about healthcare topics. I'm joined today by Dr. Genna Lubrano. She is general surgery and trauma trained, and we've had the honor of having her as part of our medical staff for the last 5 years. Yeah. And so, Genna, I'd just like for you to kind of tell me a little bit, and for our audience to hear kind of what is it about our style of surgery that is different, because everybody thinks hospitals are all the same. They're not.
Correct. Yeah. So just briefly about myself, I came from Baylor, was where I did my residency training out in the medical center. We did a lot of really big, intense operations, had a very robust experience there. And I knew that I wanted to bring those skills with me out to the community.
Excellent.
And so didn't want to stay in the med center. I wanted to come out and serve the smaller communities. So that's why I decided to come out to OakBend. And I've loved it ever since. The community of patients have been amazing in the hospital, and teamwork is great. So what's nice is when you come out to OakBend, you can, in our small town of Richmond, you can get these big, serious operations here in our hospital without having to go all the way down to the medical center, which I think is a plus. Yeah. Also, what's nice is we have, I would say our hospital is a lot like a family. I come from a very large Italian family. I value the family aspect that OakBend has. And anywhere from the nurse to the ancillary staff to my co-physicians, we all work together like a family. We're like friends, you know, and we want our patients to feel the same way. So we treat our patients like family members, ultimately. We get you in seen, we see you fast. We're not a huge facility, so our caseloads aren't huge, where you're waiting in line, you know, for 2 weeks to even months before you can get your operation. So you can see us, we'll see you that same day in the emergency room. Let's say it's an emergency. See you in the emergency room the same day, get you booked shortly after, maybe even the next morning, and then you're off and home the same day. So we're speedy, we're a good team, we work together, we're like family, and we treat you the same.
That's awesome. Yeah. And as unfortunately, a frequent flyer in surgical departments, I can speak from a patient standpoint how important that family feeling is. Because I'll be frank, I mean, you guys live in surgery. It's scary for the rest of us. It's really, and like I'm having surgery Wednesday, and I'm already starting to get myself worked up about it. So I really appreciate that, and I appreciate your time. And we'll talk again soon.
Great, thanks for having me.
Thank you. Join us next week for another Cup of Joe. Learn a little something every week about healthcare. Thank you very much.